Well, hello. Good evening, everyone. Welcome back to the show. Hopefully you had a great Monday and actually had a great weekend. So we are glad that you are here. Oh, man, I'm so excited. We got a good show for you tonight. This is Dr. Dwayne Wood, if you're new to the show. And that's Wood with an E. The E stands for endocrinology. And we here on this channel, we help to educate you, we help to empower you, and we help to encourage you to take charge of your health, avoid complications, health and life, avoid complications, live a healthy, fulfilling life, and go to the next level. Guys, I'm so geeked for tonight's show. A wonderful one. We're talking tonight about chronic diseases, the true cost of chronic diseases. It's one of those conversations that you got to pull up a chair, get your favorite beverage, and sit and get engaged. We're going to have a good time tonight talking about this, finding really to unpack some of the true cost, right? What is the real burden of chronic diseases? So that's what we're going to be talking about tonight. If you are new to the area, if you're new to the channel, please go ahead and put new, because we'd love to welcome you to our channel and to our community. If you have a question as we go throughout the evening, please make sure that you put that in the chat, and make sure you put a Q in front of that question so that we know that that is a question, and then we'll get to it as we go through the night. As usual, I'm wearing one of my t-shirts, right? That's right. So we went to Hawaii back in the fall, and I hiked up Diamond Head, right? So that's what you got, right? I hiked it. So I got a hat that goes with it, and I got my t-shirt. So shout out if you've not taken a trip. I mean, it was beautiful. We had a wonderful time there. Spent some time with some friends, and went snorkeling, and actually we went on two islands, so that was fun. And I actually met up with one of the other YouTubers out there, Doc Rock. So shout out to you, Doc. Thanks for meeting me when I was out there. So tonight we are having a good conversation. This is one of those that you want to make sure that if you have a friend, if you have someone who is suffering and living with a chronic disease, this is a show that you want them to have and you want them to listen to. So go ahead right now. Go ahead and like it if you're here. Give us a thumbs up. If you're watching this on the replay, give us a thumbs up, give us a like, and type hashtag replay in the comments so that we know that you're there, and we'll be sure to look at some of your comments. So as my pastor says, be an Apple apostle, an Android evangelist, and go ahead and hit the share, hit the like, send this out to some people, because this is a good one for them to be. If you are here, please make sure that you hit us up and find us on all of our social media platforms. We've got LinkedIn, we've got TikTok, we've got Instagram, which is not on the screen right now, but it's out there. You can go over and see what we're doing on those various platforms. Always remember that we are here every Monday night at 7 o'clock for our show. We've got exclusive health and wellness talk, and glad that you join us when you do. And we're going to just go ahead and hit that up right now. If you have not already taken advantage of our coaching program, please make sure that you do it. We're going to talk a little bit more about that a little later in the show, but just make sure that you are availing yourself of that. If you got family, friends who are stuck, seem to be stuck, want to get unstuck, we'd love to be a part of their solution. Awesome. All right, let's see who we've got out there. Look like we've got some folks. Aha! You got Anthony. Hey, man, Anthony, welcome. How you doing tonight, man? Thanks for the good music. Every time I hear that music, I feel like I want to go on the beach somewhere, right? right? Put on some shorts, get on some flip flops, and just go hang out. So glad that you are here, Anthony. We've got Dr. O. Hey, man, welcome. Hey, guys, if you've not done so, Dr. O, I met him recently. Go ahead and check out his channel as well. He's doing some good things over there, like the shows that you got over there, Dr. O. So welcome. Thanks for joining us. And I'm gonna give you a little hand clap right there. And Anthony, let me give you a hand clap as well. Hopefully you guys can hear all that stuff. Good. Let's see, Ashley. What's up, Ashley? And oh my goodness, Ella's with you. Hopefully she's doing well. Hey, Ella, nice to see you. Thank you for bringing mommy, by the way. Yeah. I know you're the one. I know you brought her. So. And then Dr. Charmaine, how are you doing, Dr. Wood? Hey guys, that's my other half right there, Dr. Charmaine. Thank you for joining us tonight. And then, hey Matthew, you're here too, man. The whole family, you brought everybody. I love it. And then Florence, how are you doing? Thank you for joining us tonight. Glad that you guys are all out there. Go ahead and give us some thumbs up, and then just send this out, share it with everybody who's not here. And if you are now watching this on the replay, we love to hear your comments. We want to see you engage with this topic. Very interesting topic that we are going to discuss. So why don't we just jump right into it, guys? Let's just jump right into it. Once again, remember, we're talking the true cost of chronic disease. And really, I should make the title, The True Cost of Living with a Chronic Disease, right? True cost of living with a chronic disease. But anyway, that's okay. So chronic disease, it is a huge issue. We talk about individual diseases, right? We talk about high blood pressure. We talk about diabetes. We talk about high cholesterol and heart disease and so forth. And we talk of them almost like they're in isolation. And we talk about the particular disease itself, but sometimes we forget to come back and take a step back and talk about, well, what is this disease doing, right? So we already know some of the symptoms. We'll get to some of that in a minute. But 6 out of 10 people in the United States lives with a chronic disease. Huge number, right? 6 out of 10. 4 out of 10 live with 2 or more chronic diseases in the United States. So that 6 out of 10 is people who live with one chronic disease, and 4 out of 10 of those have 2 chronic diseases. When you get up to patients who are or people who are over 65 years of age, then 80% of them are living with chronic disease. And we talk a lot about the cost of chronic disease, right? Of course, we talk about the healthcare cost. We talk about the money that we spend. And you want to hear this number? Yeah, do you want to hear the number? Yeah, $4.1 trillion, right, in healthcare costs in the United States. That's the budget. 90% of that, 90% of $4.1 trillion is spent by people who live with chronic disease. Now, and that's trillion with a T, not a B, right? Trillion. I'll take a fraction of that, right? So if you want to stop by, just drop me off. Give me a percentage of a trillion, all right? I'll be happy to take it. That's a lot of money. And that is divided among the various aspects of managing chronic disease. And we'll get to some of that here in a minute. But that's a huge financial burden, right? So $4.1 trillion in healthcare money, dollars, and 90% of that is spent on patients who have chronic diseases, chronic illnesses, right? And as you read through the literature and find all the studies that they're doing, that a lot of people are now developing more and more chronic illnesses. So they don't just have one, but they have multiple. And this is more common, right, in our minority communities, in African American, Native American, our Hispanic, right? So a lot more prevalent in those, and there's lots of reasons. We won't get into that here on this show. Dr. O on his show may talk about some of that, right? But yeah, lots of reasons why that can happen. But the big burden, huge burden, $4.1 trillion. And when we look at the group of people who are, if we break that group down, right? So obviously 60% of people with one chronic disease, and 12% of people have 5 or more. 12% of the 60% that have chronic illnesses have 5 or more. Huge. Okay. And the most common chronic illnesses, and we've heard these lists before, right? So heart disease, cancer, chronic lung disease, stroke, Alzheimer's is a big one, right? Parkinson's disease, diabetes, obviously, that's one of my areas, right? And chronic kidney disease. So all the things that we've heard of, but there are other diseases, other illnesses that are chronic that don't necessarily always come to the forefront of our mind. One of the ones that I pick on all the time is rheumatoid arthritis. That's a chronic disease, and we're going to use that as an example here in a little bit as we go. Like we said, 80% of the people who are over 65 years of age, right, have chronic illnesses, right? And the most common chronic illnesses that they have are, once again, heart disease, high blood pressure, kidney disease, arthritis. That's a big one as we age, as we get older, right? Diabetes, obviously, and mental health, right? We did a show maybe 2 weeks ago with Mr. Choya Wise, right? Go back and watch that. But mental health, this is Mental Health Awareness Month. Huge burden as we look at this, right? So 90% of that money is with people who have chronic illnesses. But here's the kicker. We talk about the money, but that is not the only burden. That is not the only cost, right? Remember the true cost? That's not the only cost. Of course, there's the financial cost. Now, we talked about the money, right? The healthcare dollars that are going into taking care of these patients. But let's back up a minute and let's think about some of the other monies that's not in that number. Okay. So let's think about lost productivity. So a patient who, for some reason, can't show up on the job, there's lost productivity for that employer. So that's a cost. That's a financial cost for the employer. Or if that patient, that person, that employee, that team member can't show up, then the employer has to go out and get someone to fill that spot, right? Maybe a temporary worker or someone else. And so now we're putting out money, outlaying money because of this chronic illness that has caused an issue, right? So whether it's a pain, whether it's a patient who has diabetes, for instance, who's having hypoglycemia, who's staying at home, taking some time off that morning to treat the hypoglycemia, someone who has an infection, right? Who for some reason can't make it, right? All of those things, and that's not in that $4.1 trillion. The 60% of people, that's 6 out of 10 who have the chronic illness, who do you think is taking care of them? Yeah, that's the other 40% sometimes, right? So there's also that aspect that's not figured into the $4.1 trillion. So huge cost that's not there. And then we can keep going on and on, right? So one of the things that we will see in patients who have chronic illness, and let's talk about a couple of scenarios. So chronic illness, the illness itself has its own manifestations. And this is where I say I'm going to pick on the rheumatoid arthritis because this is an easy one to talk about. So rheumatoid arthritis, so you have joint ache, joint pains. So you have swelling of the knuckles, swelling of the joints. You've got inflammation. They're red, they're hot, they're painful, right? Those patients can sometimes have some deformities that you will see, right? So there's obvious, the thing itself is causing a problem. And then as we see here in a minute, the having the disease, having a chronic illness can predispose to other things. So we got the joint aches, we got the inflammation. Now, before we go on, I want to give a plug here and teach you guys a concept. And it's called the low energy state. And my shout out goes to Dr. Francis, who taught me this years ago, right? Years ago. So we've always said that the point of the body, the function of the body is to keep us alive, right? Remember that. That's why your body is here, is to keep you alive. And it will do anything it possibly can do to keep you alive. At the point of even losing other parts of itself. So what does that mean? That means that if you have an infection in the foot, the body says, I'd much rather lose the foot than lose the rest of the system, right? So I'm going to keep everything else alive. I'm going to let the foot go. I'm going to have it it's going to gangrene off. It's going to fall off. I will lose your nails or your hair. All that stuff will go so that I can keep the other parts of the system alive. Love it, right? That's what the body does. So the low energy state says this, that anytime something in the body is compromised, then the things that are most expendable are lost first. Anytime something in the body is compromised, in order to conserve, to save the rest of the body, then the body says that the extraneous stuff, I'm going to let that go. And the most common extraneous or expendable things are the rapidly turning over cells. Rapidly turning over cells. Remember that, right? So just a little teaching there. So what are some rapidly turning over cells? What cells turn over all the time? Well, I can think of some. Skin. Skin is always turning over. So if I don't have enough energy, right, for the system, because I've got this low energy state, because something in the body is bad, a chronic illness, chronic disease, it's causing inflammation, it's causing some other things to go wrong. I'm spending a lot of energy from the body to fix that or treat that or stay alive. The body says, hey, I don't really need that much skin. So your skin becomes dry, right? Diabetics all the time, or people who have, lots of chronic illnesses will say, hey, my skin just seems a lot dry. I get out the shower and I put stuff on, I put moisturizer on, and then a couple minutes later, it's dry. So that's a perfect manifestation, right? What else? Nails. So your nails, we don't really need nails to live, right? To survive. So the nails become brittle. Your hair starts to break and fall out because the body says, hey, I'll get rid of that because I want to keep the rest of the system going. Menstrual cycles. We had Dr. Lilith White, who was on last week, actually, talking about endometriosis. So the lining of the uterus, right? The endometrial lining sloughs off. So menstrual cycles go away for women. Men, sperm, that's rapidly turning over, right? Because those guys are being produced. Well, if I don't have enough energy for the rest of the body, there's no reason to produce sperm. So the sperm count goes down. Right? You begin to get the idea, right? So all of those things begin happening because the body is trying to stay alive. And this happens as we look at chronic illnesses. Now, we're not talking specifically about the disease itself, what it's doing, right? But the rest of the body is compensating. And because it's doing that, we begin to see these symptoms. So huge, right? That's low energy state. So dry hair, dry nails, dry skin. Well, if my body is spending a lot of time trying to protect me and keep me alive, what else can I feel? Fatigue, right? So people will come and say, oh, the fatigue is caused by this or that or that or that. Maybe it's just the chronic illness, the chronic disease itself, because we're expending so much energy. All right? People begin feeling fatigue. And of course, one of the muscles in the body that we use often, all the time, every day, is the diaphragm, which is responsible for what? Responsible for breathing. So people become short of breath. You see how this all ties together? All right, the low energy state. Okay, so all this stuff. And then, of course, there's GI upset because the lining of the stomach is turning over all the time. So all those symptoms, guys, dry hair, dry nail, dry skin, brittle nails, decreased menstrual cycles, decreased sperm count, right? Ulcers, all of those are things that can occur due to chronic disease. Well, it also brings some invisible things, right? So we've talked about the physical manifestations, right? Swollen knuckles, for instance, in the case of rheumatoid arthritis. We've talked about this low energy state and all those kind of vague symptoms, right? And then now, right? What's the other thing, right? That we can see? We can see fatigue. We can see pain, right? So that's not visible, but those are symptoms that patients will tell us. I have a lot more pain. I have a lot more fatigue. Now, here let's throw diabetes in here, right? So diabetes is one of those where we've got neuropathy, right? We've got the apathies. So retinopathy, neuropathy, nephropathy. right? So all those things now come falling in. The other thing that patients with chronic diseases will have is a hit to their self-image. Can you imagine having a chronic illness that may cause some physical deformities, right? So you've seen people with rheumatoid arthritis, depending on how extensive it is. So they've got some physical deformities that you can actually see. Or maybe this is someone who has neuropathy, right? Which you can't see, but their balance is off. And so they're not as sure as they used to be. Maybe they've got hip problems, back problems, leg problems, right? They're a little bent over more than they were before. Right? People who are on dialysis, now they've got a fistula. Right? So there's this hit that goes to their self-image. So once again, we're talking about the true cost of chronic illnesses. Right? Decreased community. Because if I can't do all the things that I want to do, that I used to do, right? Maybe I pull away from people. Maybe I don't go all the places I used to go. I can't throw the ball anymore to my son. I can't play catch. I can't play soccer. I can't play basketball with the people that I used to play with. I can't interact with them. So now I'm pulling away from that community. And sometimes it's not a conscious pulling away. It's just I can't do those things anymore. There's loss of autonomy because now I need somebody to help me. Particularly if I'm getting older, I've got to get my family to drive me places, take me places. Maybe my mentation, maybe my thought process, maybe I don't have the energy anymore, right? I always want to sleep. Loss of autonomy. Stress. And we've spent a lot of time on this show talking about stress. The effect of stress on the body, on the mind. Why would they be stressed? Well, there's this new disease. It's uncertain. I don't know. What does it mean? What does it mean for my life? What does it mean for my ability to engage in my life? What does it mean for my ability to connect? What does it mean for my ability to make make money for my livelihood? So 4.1 trillion is just the financial burden. And that anxiety, chronic anxiety, what do you think that leads to? Chronic pain, what do you think that leads to? Oh, yeah. It leads to one of the things we're going to talk about here in a minute. Let's take a break and let's see who else is out there. Let's see what we got going. So Florence, we said that. So Dr. O said, preach, doc. We need to get together to talk on these issues. This is my favorite topic. Man, Dr. O, we got to, yeah, for sure. We got to get together. All right. I love your logo, by the way. Yeah, I need to get you to help me with mine, man. Love it. Let's see what we got. So Dr. Charmaine says the concepts of low energy state applies to so many body system dysfunctions. Great concept that explains so much. Thank you for this. Yeah, thank you, Dr. Charmaine. Yeah, love it. Okay, so this next one, guys, right? And I paused there deliberately because this one is huge. So once again, we're talking about the true cost, the burden of chronic illness. We all talk about the money, right? The money, the $4.1 trillion. But as you see, there's a lot more burden, right? The true cost of chronic disease. And this one is huge because it impacts so much. 30% of the people who have chronic illnesses are depressed, have symptoms of depression. And depending on the disease process, it could be even higher than that. Let me read some of these to you. So heart attack, people who've had a heart attack, between 40 and 65% of them are depressed or have symptoms of depression. People who have coronary artery disease, even though they have not had a heart attack, 18 to 20% of those people have symptoms of depression. People who have Parkinson's disease, another chronic illness, chronic disease, 40%. Multiple sclerosis, 40%. People who've had a stroke, 10 to 27% with depression. People who've had cancer, 25%. Diabetes, 25%. So what are the symptoms of depression, right? What are the symptoms of depression? One, they've got a mood. They're down. So you run into them. You see them. They're not as upbeat as they used to be. They don't like to do the things they want to do. Anhedonia is what we call that. They don't find pleasure in doing the things that used to bring them pleasure and joy. They've got weight loss or weight gain. They've got sleep disturbance. Either they sleep too much or they're not sleeping at all because they're up, they're wired because they can't sleep. They can't concentrate. They feel worthless. They have low energy, fatigue. And sometimes they even have thoughts of self-harm. Why would somebody who has a chronic disease, why would they get those things? Well, for lots of the reasons that we just talked about. First of all, they may be angry, right? Because they were diagnosed maybe recently, or they've been diagnosed years ago and they still have not come to grips. I've seen people in the office who've had diabetes for 10, 12 years, and they still have not accepted that diabetes is now something that's a part of their life. And as a result of that, they're not really controlling, right? They're not spending time figuring out how to control their diabetes, their blood sugars, how to get better. So they're angry. They're in denial. Why me? Why not the other guy? Particularly if they think they've been doing a good job. I've been doing a good job. Why me? Why do I got to get this? Why can't it go away? They have regret. Maybe somebody has told them, maybe their doctors told them, their family has said to them, hey, you need to get this stuff under control. You need to do this. And they didn't do it. And now they're living with this chronic condition. And they say, oh man, I should have, man, when they told me about that, I should have done it. I should have listened. Right? Sometimes they're going through all the things of grief, right? They're isolated. Maybe they've lost autonomy, right? How many of you out there have family members and you are trying to do something for them, right? And they're like, no, I got it. It's not that they don't appreciate it, but they want to retain some sense that I can do this stuff. Some of you are trying to get mom or dad to come live with you and they're resisting. It's not that they don't appreciate what you're doing, but they're anticipating, they're imagining, well, what's it going to be like when I get over there? I'm used to getting up and doing what I want. But I can't do that anymore. Somebody's got to drive me places. Somebody's got to pick me up. The complexity of managing a chronic illness. Think of all the medicines and the new stuff they've got to do. Right? All of that can cause problems. Now, I'm excited because there's a solution. There's good news. Now, all of this sounds like bad news, right? All this sounds like bad news. But there is some good news. And we're going to talk about it in just a minute on the other side of this. All right. So once again, if you are out there, please make sure that you go to our social media platforms. Look us up. Dr. Dwayne Wood. Sorry, not Dr. Dwayne Wood. Dwayne Wood, MD. Dwayne Wood, MD. On all of our social media platforms. You can type them in and it's exactly the same thing. Okay. Make sure that you get there and you see us. We went to the farmer's market yesterday. So you see my little video on Instagram, which is not on the screen, but anyway, make sure you do that. Once again, our show, glad that you are here. Please make sure that you let family, friends, and everybody know. If you're here and you've not already done so, go ahead and give us a thumbs up. Go ahead and send this link to somebody. Like us. If you haven't subscribed, make sure you do that. Talk to your family or friends and tell them to please get on here and subscribe. We love to welcome, and we are trying to grow this community as we educate, as we empower, and we encourage people, right? We're trying to get to the next level. And I said I was going to talk a little bit about our coaching. There are so many people that are out there with potential. So many people that are out there that have ideas. So many people that are out there that feel stuck. Sometimes they know something is not right, but they're not sure what it is. And that's what our coaching program does. Our coaching program helps to get them unstuck. What I enjoy is seeing and listening to a client who says, "Hey, I was here. I had this thing that I was thinking, it's going around in my head, and we talked and we came up with this plan, and man, look at where I am now." That's what the coaching does. So if you've not already done so, if you have someone in your life that is in need of that, go ahead and let them know that we are here and we want to be a part of the solution for them. Let's see who else we have out there. Dr. Charmaine says let me put that up. The impact of chronic disease is great. Lots to consider. Definitely. And that's why we titled this The True Impact of Chronic Disease. Let's see. Dr. O, the Minority Report with Dr. O, depression. Oh, let me get that on the screen. Definitely, Dr. O. Got to get you over there. And then he has he says, that's so accurate, Dr. Wood. Depression may be the one thing that burdens patients with chronic illnesses. For sure. All right. Well, guys, this is, depression is a huge one. Now, here's the interesting thing, right? The interesting thing about depression is that depression can come from the chronic disease. And the chronic disease can lead to, or leads to depression. And then depression makes the chronic disease worse. Right? Did you get that? Right? So you can have a chronic disease that leads to you being depressed. And because you're depressed, right, it makes the chronic disease worse. So it's this spiral that we get into. And if we're not careful, we have people who are out there who are in their lives who are not functioning well. They're getting along, but they're not living the quality of life like they want and they need. But I said, guys, that I was excited because there's a way to treat this. Here's the good news. Right? The good news is that we can make this better. And here's some, let's even before we get to that, let's talk about this. At one time, our lifespan was 30 years, 50 years. In 2010-ish, the average lifespan was 80 years. I want you to think about that. So we have expanded. We have been able to help people live longer. The most common cause of death at one time was from an infectious disease. And aside from COVID coming and messing that record up, we've not seen that kind of stuff in a while. So that's a positive, right? We're living longer. We have the ability to live longer. And we have the ability to treat chronic diseases. Now, let me hasten to say that if you're out there, right? If you're out there, this is not a reversing disease show, right? We'll do a show on that and healthy living and all that stuff, right? Right now we're talking about here's somebody who has a chronic disease, right? And if we're going to treat it, how do we treat it? Now here's the thing, right? Let me tell a little bit about us. I'm going to talk about doctors for a minute. Hey, wait a minute, I'm a doctor. Can I do that? Yeah, okay, I'll do it. So the way our system is set up, when a patient comes in to see us, sometimes we spend so much time talking about just the management of that disease that we don't necessarily talk about the day-to-day stuff. Like on Monday morning when I wake up and I'm in pain and I can't move and my joints are hurting, right? What do I do on Monday morning? So that sometimes gets lost in the management of things, okay? But the good news is that we can live longer. We can treat chronic diseases. And how do we prevent a chronic disease? We'll come back to treating in a minute, but how do we prevent chronic disease? We know what causes them. Between 90 and 95% of all chronic illnesses are caused by four things. 1, alcohol use. 2, physical inactivity. 3, poor nutrition. And number 4, tobacco use. I want you to listen. Alcohol, physical inactivity, poor nutrition, and tobacco. Right? So all of those things, we know how to manage those. Are they easy? Not always. Right? We all know that, right? So let's not pretend that it is easy. Right? Sometimes we have these pie in the sky kind of thoughts. Right? It's difficult, and people will take a while to get there, and we are treating them, we're teaching them, we're helping them get there. We can't expect them to be there tomorrow or the day after. It is a work of, it's a progressive work. And I think sometimes we think that maybe next week on Thursday at 1 o'clock, everybody's going to wake up and boom, they're good. It doesn't happen that way. But 2 that I want to talk about, right? Obviously, alcohol, we've got to decrease the amount of alcohol that we take in, and tobacco, right? When I was in medical school, I remember our pathology course master coming in, and he's introducing pathology, and he says to us, he says, everything that you're about to learn, if you get people to stop smoking, it all gets better. He said, I don't care what I'm about to tell you, but if you can get people to stop smoking, it all gets better. That's the power of smoking cessation. Okay? All right. We're not going to talk about those 2. We're going to talk about, and we're going to spend most of our time actually talking about nutrition, because there's an interesting concept I want you to get. And I want to use gestational diabetes as an example of this. Right? And to have this discussion. So we know that a mom who has gestational diabetes is predisposed to having or developing diabetes, just full-blown diabetes in her life, in the course of her life. We know that the bigger the babies are, that predisposes them for prediabetes, diabetes, gestational diabetes themselves, if they're female, if they're male, metabolic syndrome, and diabetes. That's the bigger the babies are. We also know that babies of gestational moms are also predisposed to all of those things. Metabolic syndrome, prediabetes, hyperlipidemia, coronary artery disease, and diabetes. We know that the smaller babies, right, those preemies, they are also predisposed to complications later on, along the same spectrum of metabolic syndrome. So if we can make sure mom has good nutrition, and mom's blood sugars are controlled, then we decrease the potential for that next generation. Notice what I said. We decrease the potential for that next generation to have problems. This is another one of those true cost, right? So we don't talk about that. So the cost of chronic disease is not just on this generation, but it's also on the generation that's coming. So if we have good nutrition in mom, then that next generation, potentially, we can decrease their predisposition. Now, let's take that even one step further. Why does mom have gestational diabetes? Maybe her mom had gestational diabetes or had higher blood sugars or had metabolic syndrome, right? So notice what happens. Now we're not just talking about the next generation or the current generation, but we're talking about the previous generation. So it is a generational thing. And if we can begin working on nutrition, right? Now we're not talking about the people currently who have the disease. We're talking about prevention now. If we can begin working on the generation, then potentially down the road, we're decreasing the burden, the cost of chronic disease. That's huge. So if you're out there, if you're listening, right, begin talking to your family about good nutrition. Now, we're not going to do that here. We're not going to go through the whole list of how we do that. We'll do another show, right? But begin talking to your folks about good nutrition. What does that mean? What does that look like? I've had people say, well, Dr. Wood, this is how I eat. My mama ate like this. My mama's mama ate like this. And sometimes that is the problem. Okay. Beginning to change that paradigm. If we can do that, man, think about that. Think about that $4.1 trillion. How can we reverse that? Physical inactivity. Just move. I love what Michelle Obama did. Just move. You don't have to go to a gym. You don't have to go to Orange Theory. You don't have to go to P35XY, whatever they call it. Right? Just move. Move a muscle. Move a muscle. Move a muscle. You burn sugar. You burn sugar, you decrease the blood sugar in your body and you decrease the insulin. Amazing. Just move. So if we can do that, wow. Well, so what about the people who actually have these chronic illnesses? What do we do with them? What do we do with them? We're going to come back and talk about that. But this is a great place for us to have our thought of the day. So let's go ahead and do that. All right. Yeah, I was dancing. You caught me. So our thought of the day is this, guys. And I want to take a page, if you will, from a book that my wife recommended to me. It's called The Compound Effect. The Compound Effect. And the compound effect is, just like you probably think it is. It comes from money, right? So you take $1 and you put it in, or if you actually take a quarter, if you will, and if you can double that quarter every day, right? After a while, you're going to be a millionaire. Actually, more than millionaire. So you take someone who is, I don't know, pick an age, 16 years old. And you say to them, hey, I'm going to give you a quarter and I'm going to double that quarter every day until you're 65. And then you take someone and you say, hey, when you're 65, I'm going to give you, I don't know, $10 million. And most people would say, hey, give me the 10 million. I'll take it. But the effect of the compound is huge. Because after a while, that doubling and the doubling and the doubling and the doubling, it outstrips the lump sum. And sometimes in our lives, we don't see the same thing. Or we don't see it that way. If you begin doing something today that's beneficial for your health, something that's beneficial for your wealth, that's beneficial for your education, and you do a little every day, if you're consistent, then your results can be much better than the person who spends a lot of time, like today, doing it. But we say sometimes, oh, that's not going to make a difference. If I don't eat that one chip, if I don't eat that bag of chip, if I don't eat that cookie, if I don't, right? If I don't read, if I read that book, if I just not read that page, if I read a page, it's not going to make a difference. But you know what? It does. It makes a huge difference because the compounding, doing something consistently over time gives results. So if you're out there, don't wait. Don't think that your small contribution to whatever it is that you want to do will not take effect, will not make a difference. It does make a difference. And you'll look up one day and that compound effect will be huge. You won't even recognize it. You say, well, how did this happen? Because I only did X, a small amount. But the small amount, consistency over time, gives big rewards. So that's my challenge for you for our thought today. Don't think that you've got to do a grand thing. You don't have to make a grand gesture. Start in a small way. And if you're consistent over time, then the reward will be huge. It will be unrecognizable because you've put the work in over the time. That's our thought for today. All right. Okay, so let's see. So we've talked about the financial burden, right? Well, let's jump out here before I do that, and let's see who else is here. So it looks like Dr. C has been kind of chatting in there. Let's see what this like. Talk about activity. Love the t-shirt. Yeah, love the t-shirt. All right. So hiking, right? So we went hiking. That was a good one. All right. If we can change our habits, we can change our lives. So important. And that's a good place, Dr. C, for me to jump in and talk about this last part, right? So what do we do? So people are currently living with chronic diseases. Okay. So here's some practical things that we can do. I want to talk about pacing yourself. Sometimes when people have chronic diseases, they have good days and they have bad days. Yeah. Whether it's a pain, whether it's fatigue, short of breath, whatever it is. And so what happens is on the good days, they feel like Superman and Superwoman and they do everything. They paint the house, they rearrange everything, right? They cut the lawn, they put the shutters down, they pressure wash the floors. And then for the next 3-4 days, they are wiped out because they've expended that energy. So what you want to do if you live with a chronic disease, the first thing to do is to pace yourself. Find a reasonable amount of activity that you're going to do and do that kind of activity every day. So on days when you're feeling elated, don't overdo it. And days where you're not feeling so great, the amount of activity that you've already selected is manageable. And so you become more even in your activities. And so you don't spend 3-4 days recovering because you've gone above and beyond on those days when you felt good. So pace yourself. And on the days when you don't feel so good, look at the act and say, hey, this is what we decided that we're going to do. Which brings us to mindset. Change your mindset and you change everything else. Now, I had someone just today was giving an example. And she said that, it's much easier to do something physical than it is to change an attitude. That's true. If I told you to get up right now, you could probably get right up, right? So easy. But to change a feeling, actually, not attitude, but change a feeling, that's hard. It's like, hey, I'm mad right now. Stop being mad. It doesn't work so well, right? But you know what controls that? This guy right here. The brain. And so as we are feeding the brain, right, and we're practicing, right, we change the mindset and we begin changing how we feel about a thing, and we begin changing how we behave. And that takes community. Because sometimes you're in a funk right now. You're listening to me. You're like, yeah, whatever, Dr. Wood. You don't know what the pain I'm going through. You don't know the depression I'm in. You don't know the whatever it is. That takes finding a community. And if you are in someone's life, if you are in the life of someone who is living with chronic pain, then you've got to facilitate, you've got to help find that community. There are online groups. There are communities all over. The CDC on their website helps you to find different programs, different places where people can begin working with you to manage the chronic disease. Talk to your physician. As the physician is talking, and like I said, I have to be honest. I'm going to put myself in that group. Sometimes we're so focused on the disease, managing the disease, that we don't think about the everyday things. That's not because we don't care. But if you're in the situation, talk to your doctor. Don't just take it. Don't just accept it and say, well, oh, he's too busy. Stop him and say, hey, doc, can we talk about such and such? He may say, hey, let's come back and spend time talking specifically about that. We may not be able to discuss it today, but bring it up. Remember, our goal as physicians is to help you live as long as possible and be as healthy as possible. And as I tell my patients, right, if the quality of life you have is not good, then what's the point? So quality of life. And then making sure that we are managing those diseases, right? Because we got to manage the disease itself so that it doesn't worsen. And to prevent you from getting other diseases, other chronic illnesses, remember, minimize your alcohol intake. Increase your physical activity. Monitor and take care and learn how to have proper nutrition, and decrease your tobacco use. Hey guys, I am so excited that you are here. Let's see. Let's jump back to the comments here for a minute and see what's going on here. We have Carrie. Hey Carrie, how are you doing? Hello, welcome to the show. Awesome. Glad that you are here. And, we love what we do. We love being here. We love the education. We love the empowerment, and we love the encouragement that we do. Please, if you're out there, once again, like this show, like this episode, send it to someone. There are so many people that are out there that would benefit from just hearing some of the things that we discussed tonight. Let's see if there are any questions. If you guys have any questions, go ahead and put those in the comments there, so that we can grab some of those and answer them. Okay. One of the most common things that people have in the chronic illness, chronic disease category is pain, because a lot of diseases will generate pain, as we talked about the rheumatoid arthritis, right? Diabetes will also, so that's the neuropathy. And so one of the things that happens sometimes is that people will, because they're feeling the pain, they'll say, I don't want to exacerbate the pain. So they will decrease their activity. And it makes so much sense, guys, right? They say, well, if I'm in pain, then I'm not going to move as much. But sometimes the lack of movement itself exacerbates and or makes the pain worse. If we think of a typical example, right? So knee and hip and back, the muscles that are surrounding the place that's in pain are instrumental in helping you move and or dealing with the pain. So if all of a sudden you stop moving, then those muscles that are supporting muscles, they become weak. And when they become weak, then the pain can be worsened. Okay? So don't just give up, right? Find a place. We've got a guy here in town that I send a lot of people to, or send people to, that does wonderful work, right? Find a physical therapist. Talk to your doctor. Hey, what can we do? Right? If you're at home, sit down in the chair and do some exercise, do some strengthening exercises, right? Get an exercise band and work those joints. And I'm not here telling you that it's easy and it's not going to be painful. But the choice of moving that joint, right, and within reason, right? So don't go out and start lifting 500 pounds. But the ability to maintain movement and maintain fluidity and maintain strength is dependent on you continuing to do the things that you need to do, right? For that joint, for that back, for that leg, for whatever it is. Okay. The same thing for people who may have some balance issues, right? If your doc, they've not been able to figure out what's causing balance, then there are places that help you with balance. If you have poor vision, right, on our on our exams, one of the perfect questions that they ask is, Mr. Jones fell at night, and he, what caused it? And they've got choices on there, right? One of the choices, a throw rug. Yeah. So he tripped. He got up at night. It was dark, and his feet got caught up. So look around your home and find those things that can cause problems for you and begin working on those, right? So maybe your floor, let people see your floor now. Take the throw rug away. Get a night light so that at night when you get up, if your vision is dim, if your vision is poor, that you have lights that are going to illuminate the room. It doesn't have to be bright, but just enough so that you can see where you're going. Because sometimes I know I get up and it's dark and I can't tell, where's the bathroom? Which way? Which way do I go? Right? So very, very practical things. And like I said, on the CDC website, they have lots of resources that you can get to. We'll put a link to the CDC and then you can get from there. But guys, as always, thank you so much for being here tonight. We love when you come by. We love to empower, to educate, to encourage you, to take charge of your health and your life, to live that fulfilling life, avoid those complications, and go to the next level. This is Dr. Dwayne Wood from Diabetes and Endocrine Wellness Center saying good night. We'll see you at the next video. Let's get some music and let's get on out of here.